again, we would be privileged to talk about another very germane, important conversation. But just like it was said and announced earlier from our station here, that this conversation would benefit the male gender even more today. And notwithstanding, this is also to tell every female gender out there, as mothers, as wives, as even children, to men out there, that you need to listen to this very, very important educative segment that has to do with health, so as for you to be aware. Information as well, they say it's key. So today, for every man out there, I crave your indulgence to stay tuned with us from 11 up until 12 p.m. where we will talk about difficulty in urinating in males. Yes, difficulty in urinating in males. I will be your host for today, and my guest in person of Dr. Odutola Oyewo, a consultant from General Hospital Ikorodu, is also with me in the studio, and together we would look at difficulty in urinating in men. Some of us would not even want to acknowledge the fact that this could be a problem because some men feel like, it is not something that exists. I have heard people say that, no, a man would not even want to go through that because it's a natural thing for you to just wake up in the morning especially and then urinate. But there is so much more for us to learn. Talking about issues with urination in men. This may arise due to multiple factors. All of these factors and more we will consider today. My name is Okwayemi Adebambo, saying good morning to you. A very short breather would suffice, and when I return, we get talking on difficulty in urinating in men. You're welcome back to the Issues on IKD 106.1 FM. My guest, well seated, is a doctor from General Hospital Ikorodu, Dr. Odutola Oyewo, who will do justice to the conversation this morning. Good morning to you, doctor.
Pleasant morning to everyone listening.
It's good to have you in the studio.
From the home, your car, or in transit. This morning, I'd like to talk to us about the difficulties men or the males could have in urinating. And I think I should mention here that it could even start from our newborns, though it's commoner in our middle-aged and elderly men. Okay, though no age group is totally exempt. For the newborns in particular, though not very common, but it's worthy of note to mention to our people that mothers should be observant of the stream of their baby's urine. Okay, so this will help to realize there's a problem. Though from antenatal screening, the scan, we have picked up there's a problem with the child, showing that the kidneys are swollen up. But let's go back to the topical or more common presentation that afflicts most men. Just to put it out there, the urinary system, the way God made men is such that our kidneys produce urine. And then this urine travels down two pipes around the back. And those pipes take the urine into the urinary bladder. And when the urine bladder is full, it sends a message to our brain, find a convenient place to go and empty that bladder. And that is where many people find out that the urine is not coming well. They have to strain for it to flow well. Or the urine is spraying, or it's painful, or there's blood in it, or it's offensive in odor, or it has a milky color, or other complaints that many people experience. And they begin to think, what could be going on, all right? So particularly for men, under the urinary bladder, there's an organ called the prostate gland. Okay. And in men, they also have a penis that houses a structure called the urethra. So for men, the difficulties that may cause problems with their urination, could have come about from problems involving any of the following areas of their body. The urinary bladder. If the bladder is diseased or affected by any way.
Doctor, we'll still get to talk about the causes of yes. But then I just want you to first off clear the air to help those that might want to say that when you talk about difficulties with urinating, some men will tell you categorically that I do not have, for instance, extramarital affairs. Some will tell you that I do not have health issues, so therefore I might not be faced with this. So you are saying it now that this is something that could happen to any man, irrespective of how much you take care of yourself.
Well, to a wide extent, a man living old enough, exposes him to the risk of prostate enlargement. Okay, so if a man lives long enough, there's nothing he can do about it, especially with a black man. There's nothing he can do about him saying his prostate should not grow.
Okay.
If the prostate grows, it now goes into narrow the passage that urine has to pass, causing difficulty in urinating for most middle-aged and elderly men. So the other thing of note now is if that enlargement is one that is cancerous and one that is not non-cancerous. But I think I should also talk about the symptoms that
yes, we'll definitely get there. We will get there. We will get there. I want us to take it a step at a time. We'll get there. We'll get there. So now, with what you said, I'm hearing it for the first time now that when you talk about issues with urination, it has nothing to do with age. I heard you earlier at your opening glee when you said that even a child could be affected. Originally, we know that, or we hear that it's something that affects the elderly ones alone, the older man. So when you talk about the age factor, it has nothing to do with the age factor.
Well, age factor helps the physician to try and understand what may have caused it. Like for the newborn now, when the baby is born and there's something we call the posterior urethral valve. If that valve doesn't get dissolved during the baby's development, it will cause a blockage.
Okay.
That will cause the baby to have difficulty urinating and can cause serious injury to the child. For the younger men who may be having unprotected sexual intercourse, who may have had injury, maybe fall into gutter or trauma during playing football or fights or assault, they were kicked in the groin, they can have injuries to their urethra and cause difficulty urinating for them too. And that may not manifest until a few months or even a few years down the line. But for the men above their 45 age and above, those are men who are at risk, especially those who have family history of prostate disease. Okay, those are the men who have risk of having enlarged prostate gland size. And if the prostate gland is enlarged, it's the commonest cause. You can have narrowing of the outlet that urine should pass through. And it can cause a serious amount of problems affecting the bladder, affecting the patient's kidneys.
So this could be an hereditary illness too as well.
Oh yes, it could be hereditary.
Wow. So for the fact that it has happened before in the family, a man should know that there are tendencies, possibilities of also facing this same situation.
Oh yes, for patients who are diagnosed with prostate cancer, for example, when we see them in the hospital and realize they have sons who are above 40, we encourage them to start screening early.
Okay.
For the disease too.
Okay.
So that their own may be picked earlier than their father's was diagnosed. And it's something they should also tell their sons, if they have sons, to pass the message across so that these things can be picked up early.
Okay, so let's talk about the causes now. You already started that conversation, and I would like us to take this effectively so people can be aware of the causes when we talk about difficulties in urinating. What are some of the causes that brings about this difficulty for a man when he has to urinate?
Okay, first of all, being black is a risk factor for prostate disease. Prostate cancer is the commonest cancer in men. Our black race puts us at risk of that, and there's not much you can do about that. Family history, like I mentioned, is another risk factor. And then increased age. A man who lives long enough has earned the right of passage to develop prostate disease. Okay, and then the other causes of difficulty urinating, infectious causes for patients who may have had poorly treated urinary tract infection, especially the sexually transmitted ones, will now have a urinary tract that has healed with narrowing. So the lumen won't be wide enough to pass urine with the normal force.
Okay.
The patient may have been having to pass urine before, or the urine stream may begin to split. Can be like excessive urine is sprinkling. Sometimes you now realize that the force of the stream is now reduced. If you could target an ant before, if you are peeing, you'll not be able to do that again.
Now
and
it's
then,
scattered.
Of course, you now begin to experience other things that we'll talk about later. And then for patients who may have had a stroke before, patients who have Parkinson's disease or other neurological conditions and that can affect the body's coordination of the bladder filling and emptying urine, can have difficulty in urination.
Thank you so very much, Dr. Odutola. If you're just joining us on the issues today, we are talking to the men, especially out there. Every man has to be a part of this conversation. Talk about difficulty in urinating in males. And of course, on this conversation, we look at the causes, the symptoms, and how it can be managed. With me in the studio, like you already know, is Dr. Odutola Oyewo, doing justice to the conversation, a consultant from General Hospital Ikorodu. Now, doctor, I want us to talk about these causes. I am tempted to ask, when you say infectious causes, we know that STDs are real, sexual transmitted diseases like that of gonorrhea. Aside gonorrhea, which other kind of infectious causes might bring about difficulty in urination?
Well, infection is a blanket term for when you have organisms, proliferating where they shouldn't be. Gonorrhea is the commonest, and
yes.
For public consumption, I think that's something most people understand. So
most acceptable.
When you have the sensation of painful urination, occasionally they may also experience whitish or milky discharge from the tip of the penis. Okay, there may be fever, the scrotum may be swollen. Those are features of infections in the lower urinary tract of males. Lower abdominal pain, even fever, blood in urine. All those things are things that can point to infection in the lower urinary tract of males.
Doctor, I am not up to 40 yet, but I will tell you right now that I'm getting scared already, especially when you say that the increased age is another factor to consider for this difficulty in urination. So by ratio, by statistics, when we look at it, how many men out there have to face this difficulty in urination when they start getting to 40 and above from a ratio 1 to 10? Is it to say that at least 9% of men, immediately you get to 40, just get ready, you will have this problem?
No, please. I think I need to put this out there. It is not that once you're above 40 or 45,
okay, you
will have prostate issues. There are men in their 90s who are urinating very fine, without any problem. But it's not. There's no mark on anybody's forehead for you to say
that
this person will have. Those who are at risk, like I mentioned, family history. What do you call that now?
The black race as well. Race, yes.
Okay. Genetic dispositions that may predispose such people to prostate enlargement. Yes, for those ones, especially those who have known that their father used to have this problem. Those are the ones that may want to say, okay, let me be a little bit proactive about observing myself. So you've got a man who is 45. Okay. And okay, maybe I should. I don't know if when we're going to talk about the symptoms.
Yes, we will talk about the symptoms soon.
It's based on the symptoms you're experiencing. To let you know whether you have to worry or not.
Or not. Okay.
And then of course this idea of feeling you have an infection, and then you don't get it properly treated at the hospital. You don't do a lab test to know what organism it is, so you can get it appropriately treated. You go across the street and buy something or drink some herbs, and then somehow you feel you're good. And then down the line, you realize the urine is not flowing well. That's a poorly treated infection that's manifesting down the line now as difficulty urinating, especially for those in the middle-aged and the younger ones.
Yes, yes. So I would like for us to talk about the symptoms now so that people can be aware. But before we even talk about the symptoms, when we say there's difficulty in urinating, is it also something that the younger generation, like you said, should also worry about? Because this question is coming this way. Do you have to wait to a particular time before you start getting screened? Or you could just decide to say, okay, I'm a man, I am 20 something, can I just go for a screening test and be sure that I am safe? When should a man start thinking of, let me go for a test and check myself?
Okay, so when you say you want to go for a test, you have to answer the question, what are you testing for?
Okay.
So if it's about difficulty urinating, the first thing is to know what your normal pattern of urinating is like.
Okay.
How many times do you wake up to pee in the night normally, for example? How does your pee flow? Do you usually feel pain when you urinate, or you have to bend your leg one how to empty your bladder properly? You have to be familiar with yourself first. And then if you're talking about what to look for as a cause for urinating, I mentioned earlier that depending on the age group, some causes are more peculiar to certain age groups. Like the one I said for the newborn now, it's unlikely it will be missed. The patient is 70 years old. It will have manifested in his childhood, even of when he was born. For those who may have had poorly treated infection, maybe when they were in their 30s or 40s, will be coming out in their 50s to see. Or those who have had gonorrhea that was not poorly treated in their teenage, manifesting when they are 30 or 35. Okay, so for that one now, the symptoms will push you to realize it's something different from what your normal body habitus was. So based on that, you should seek your urologist. I'm a urologist, the consultant urologist at General Hospital Ikorodu. You seek your urologist for evaluation of the symptoms you're experiencing, and then we take it from there. And of course, part of my responsibility to you is to consider all these factors, examine you after listening to you, to find out where the likely problems is with the help of some investigations.
Let's talk about the symptoms now. But then, just like we know that doctors such as your type will tell us, I know a time a doctor said you have to brush like 3 times in a day, at least 2 times in the morning, at night when you get home. Like when you talk about meals too as well, they will tell you that eat at least 3 times in a day, morning, afternoon, and night. Take your medications. Are there any particular number of times that a man is supposed to normally, in his normal sense, urinate in a day? Maybe if you've not urinated maybe 3 or 4 times, then there's something wrong with you. Is there a particular number to urination?
Okay, so for what we consider abnormal, we don't expect anybody, male or female, to urinate more than once within 2 hours. So I can sit here from now till 4 p.m. before I feel pressed. That's not bad. Okay. But if between now and the next 2 hours I have to stand up from here and go and urinate more than once within the next 2 hours, there's something is wrong. Fishy. Of course, that can happen in the setting of if you are in a very cold place and you are not used to that, or you are drinking alcohol, you are not used to it, or they've given you a medication to help empty your bladder better. But all those things are not in the normal setting. The normal person is not in those conditions. So don't start giving yourself excuses if you experience that. If you start urinating more than once within 2 hours and it's persistent, we need to look into that. That's one. 2, you shouldn't wake up at night more than 0 to maximum 2 times to pee. I'm not talking about you staying up at vigil or you watching a movie and then you are going to pee because you are awake. I'm talking about the urge to stand up to urinate from sleep more than 0 to 2 times at night. If it's more than that, we need to look into that too. So if you're there and you're listening to the issues today, you've heard it. Urinating more than once in 2 hours is something that you should think of, and definitely that tells that there is something fishy. You could ask questions if at all you have any. You could be a part of this conversation if at all you have questions to ask our doctor today in the studio, a consultant urologist from General Hospital Ikorodu, Dr. Odutola Oyewo OR. You can call the studio line or send in a text message or WhatsApp message to the studio line 0904 0821 061. That is 0904
08108211061. That's the studio line where you can send in text messages or WhatsApp messages to call and be a part of the conversation. Call us on 0904-081-1061, 0904-081-1061, or 0904-082-1061. Doctor, let's talk about some of the symptoms that brings about difficulty in urination. Let's see if we can take this first call before we go ahead. Hello to you.
Hello, good morning, sir.
Yes, good morning.
Mr. Aladwila is calling.
Mr. Oladibibe, go ahead, talk to us.
Yeah, meet my doctor there.
Yes.
There's something you call Isheto. It is part of it.
Something called what?
Yoruba people call it Isheto.
Ishito.
In English.
Ishito.
Aceto.
Iseto.
Uh-huh.
Okay.
It is part of it.
Okay, the doctor will attend to your question. Thank you very much, Mr. Oladibibe. Okay, maybe we should just attend to that before we go ahead. He said Ishito.
I know people usually use that to refer to gonorrhea.
Okay.
That's my understanding when I interact with patients. They talk about this sensation where they have they are afraid to urinate because of the intense pain as the urine passes along the penis and there's occasional whitish discharge. So yes, if that is not properly treated and it heals with narrowing of the pipe along the urethra, they will have difficulty urinating down the line.
Okay,
or it may even spread into the other tubes there, causing infertility.
Thank you very much for that one. So let's talk about the symptoms that people need to be aware of when we talk about difficulty in urinating.
Okay, so the first thing you should ask now is about how many times they urinate within 2 hours, like I mentioned.
Yes.
How many times they wake up to urinate at night. And I usually ask patients to take this walk in their mind with me.
Okay.
So as you are sitting there now and you are in a meeting, you have to be there for the next 2 hours, and the urge to urinate hits you as you are speaking. Can you sit down there till the meeting is over before you go and pee? That's a question you need to ask. 2, when you get to the toilet, if you don't quickly get there, will the urine start dropping? That's another question you need to ask yourself. And then when you get to the toilet and you unzip your trousers, does the urine start flowing immediately? Or you have to take a pause, or you have to bend in one way, or you have to lift your leg, or you have to strain for the urine to flow? Okay, when it starts flowing, does it start and stop? Is the stream good? Can you target that ant on the floor? Or that thing,
and not
that
miss
part,
your target,
and not miss it? Is the pressure good? Okay, when you finish urinating, do you have to shake your penis to be sure that you've emptied everything? As you are zipping your trouser back, do you feel some are still dropping in your underwear? Do you feel a swelling in your lower part of your abdomen? Okay, based on all of that, you will know you have some issues if the answers are yes or no. And then of course, has it ever happened that you had the urge to urinate, painfully so, and you're unable to urinate? Have you had to put a catheter in your penis before? Have you seen blood in your urine before? Is your urine offensive in odor? Do you have pain when you urinate? Do you have fever because of any of these symptoms? Do you have any pain or swelling along your sides? All these things are pointers to different degrees of difficulty urinating.
Okay. This is huge. I must tell you, this is very huge. Let's see if we can take another call. Hello to you. Good morning.
Hello, good morning.
Yes, please. Your name?
This is Sabeki calling from the Biologia.
Go ahead. Talk to us, Sabeki.
Yes, doctor, good morning.
Good morning, sir.
You see, I have 3 questions to ask. The first one is this prostate cancer. I learned that from people that gonorrhea used to cause it. Then the second one is, if you continue having sexual intercourse with an old age woman that is not menstruating anymore, that can cause it. Then the third one was, you said somebody should, if somebody you can be urinate, 3 times in the night. But what of if I eat lately, like I eat like 10:30 or 10 o'clock? So that is my 3 questions.
Okay, thank you. Thank you. I don't know if you got all of his 3 questions.
Yes, I did.
Okay, please, let's attend to them.
Okay, so his first question was about an association between gonorrhea and prostate cancer. Right now, there's no known association between gonorrhea and prostate cancer.
Okay.
What gonorrhea usually does is that it damages the pipes that urine and semen passes. Okay, so the patient is likely to develop a urethral stricture and maybe infertility. Compared to prostate cancer, which is affected by the prostate gland. Gonorrhea hardly infects the prostate gland. The second question, intercourse with an old woman that is no longer menstruating, if that causes prostate cancer. I'm not sure the age of the person you are having sexual intercourse with is a risk factor for prostate cancer, or whether the person is menstruating or not. If you are going to have sexual intercourse, please go ahead and have sexual intercourse. It should not, the age or whether the patient is menstruating or woman is menstruating is not related to the development of prostate cancer. And then I mentioned that ideally most people don't urinate at night. They usually urinate around 5-6 in the morning, and then they go ahead with their day, as it were. But sometimes, as people age, they wake up once, sometimes 2 times in the night. Once it's more than 2 times in the night, it means it's likely going to affect the quality of your sleep, and that's why it becomes a problem. Okay, so if you eat late and drink water late, naturally, you will wake up, and compared to somebody who didn't drink water late or ate late. So even if somebody came to me and was complaining of this, part of the things I will tell you first is to say, okay, if you are going to go to bed by 9 p.m., stop drinking water by 6 p.m. So that whatever you are going to pee, you will have peed most of it before you fall into sleep. All right. So if you eat late and you wake up more than 2 times, I'm not sure you have a problem because you drank water late. So let's start from you stopping drinking water late and see if that still persists.
Thank you so very much. Now, I want to ask, people out there would also want to know. Some persons will tell you that naturally I don't really urinate. For me, once or twice in a day, I'm good. It's not as if they don't take water. It's not as if they are not living the normal life every other man out there live. But they don't just urinate more than 2-3 times in the whole day. Is this also normal? Is this fair?
Yes. So your whole day is maybe like a 9 to 5 job, for example. That's how many hours? That's about 8 hours. Okay, and you are urinating 2 or 3 times within 8 hours. I think it's good as long as you're not urinating more than once within 2 hours.
Within 2 hours.
And of course, all that the amount of urine you make also depends on your level of activity. If you are sitting in an AC tight office, you're drinking coffee on your laptop, you're working, you're likely going to go and pee more than somebody who is walking up and down supervising a construction site. All right, and who may not have time to sit down and actually drink water except when he's having his lunch or his breakfast. So if within 8 hours you are you are sitting down in an office, drinking coffee, eating at your desk, you're likely going to pee more than somebody else who is not doing that. So each person's habitus or lifestyle is contributory to how much urine you make. Okay,
thank you so very much. Still the issues where we talk about difficulty in urinating in males. This is very, very important. Now, for people listening out there, and part of the symptoms you mentioned, they're already feeling like, oh, maybe I'm in this class, I am in this circle already. What should be the first move for a man who is listening to you right now, doctor? What should be the first thing a man should do when he feels that some of the symptoms you mentioned, I think I have this one, I have that one? What should be the first thing for them to do medically?
Well, it's when you feel there's something abnormal, you should seek for a second opinion to be sure whether it's you are being oversensitive or if there's an actual problem. So for men, especially the men in their middle-aged and elderly group, if they feel they are having difficulty in urinating, they should come and see a urologist. You can come to the General Hospital in Ikorodu and be evaluated and examined. Because another thing that a patient cannot do by himself is to examine his prostate. Okay, though you can do scan, but a scan cannot tell you what the prostate feels like, which is what I will do when I physically examine you. Okay, and then to know which investigations to request for, which ones not to request for, and if there's something we need to do something about, or if something we need to observe. If your diet and lifestyle modification can reverse some of the symptoms you're having, perhaps like the gentleman who asked about eating late and waking up more than 2 times in the night, all he may need may be to stop eating late or stop drinking water close to his bedtime, and he goes back to sleeping well. Right.
Thank you very much. Now let's talk about some of the ways at which one can manage this difficulty in urination. It's also very important for us to know this one, or preventive measures, if at all, depending on how you people call it. Is it a curable disease? That is when it gets to that level of the peak, so to say. Is it something that is curable or manageable? If you know it's not curable, what next should people do? But let's take this call and listen to this person. Hello to you. Yes, good morning.
Is this IK Radio?
Yes, IKD Radio. Good morning. What's your name? Hello. Okay, you can call us back. So let's talk about how it can be managed or cured, if at all.
Okay, so I need to also set something straight here. Difficulty in urinating is not a diagnosis.
Okay.
It is usually secondary or due to something else. So it is my responsibility of care to you to find out what is causing the difficulty in urinating.
Okay.
So following our interaction and my examination and investigation, we'll be able to say, oh, this is the problem. Is it from the bladder? Or, oh, it is from the prostate? Or, oh, it is from the stricture? Oh, or it's because you've had a stroke before. That's why your bladder is not able to coordinate well, and that's what is going on. Okay, or, oh, you have an infection. So the difficulty in urinating is usually due to something that we'll need to unravel following clinical evaluation. So talking about curable or manageable also depends on what is causing the difficulty in urinating. So for patients who may have just bothersome symptoms but don't merit any surgical treatment, okay, yes, those ones may be curable with medication and lifestyle modification. But for those who may have significant blockage, like that child I said who was born without valve, that child will need surgery to open up the road so that the kidneys will be protected. For the man who has enlarged prostate, okay, that is not allowing him to urinate, or that the bladder has to climb with the pressure so high to overcome the prostate size, that kind of patient will need surgery to cure that difficulty in urinating. For patients who may have what we call a stricture, okay, may also need surgery to either dilate the stricture or to remove that strictured part and join the urinary tract back together. For the patient who may have prostate cancer, if it is diagnosed early, and by early I mean it is confined to only the prostate from different tests that have been done and there is no evidence of spread, radical prostatectomy or radical radiotherapy, please excuse me, is a treatment that can cure early prostate cancer. For those who may have prostate cancer that are spread outside the prostate gland too, there are also things to help preserve the quality of life the patient may have so that his outcome can be bearable.
Doctor, before we would let you go, I still want to ask you some very few questions on this conversation, and you can also be a part of this conversation from anywhere that you're listening, joining us on the show today, talking about difficulty in urinating. For the male gender, all you need to do is call us or send us a text message to our studio line 0904 1061 or 0904 081 1061. Aside the fact that you mentioned sexual transmitted diseases, I also want to know, is this difficulty in urination, is it something that is contagious as well? Hello to you. Hello.
Good morning.
Yes, good morning. Your name? This is IKD 106. Do you have a question for our doctor?
Yes. My question is that if somebody that you want to urinate and you stand up to urinate, immediately the urinator is coming out fastly than you may wee in the body.
Okay. So you want to ask what's the cause for this?
What's the cause of? It's always happened to me.
Okay. Thank you. The doctor will attend to you. Just stay tuned. Thank you. Thank you. Okay, doctor, I believe you got that.
Okay, so to answer your question initially, if difficulty in urinating is contagious.
Yes.
Well, difficulty in urinating is not contagious.
Okay.
But if a man has gonorrhea, for example, now, and he goes to have unprotected sexual intercourse with his wife, he can give her the serial gonorrhea bacteria. But if a man has prostate cancer and he has unprotected sexual intercourse with his wife, he can't give his wife prostate cancer.
Okay.
If he has enlarged prostate and he has sexual intercourse, he can't give his wife enlarged prostate. I don't know if you get my point.
Very well.
It's not contagious. The difficulty is not contagious unless if the patient, the man having sexual intercourse, has an infection.
Okay, let's see. I think we have another call there. Oh, we lost that call. So let's attend to that man.
Urgency,
yes.
That's what he described, that he wants to pee, but before he gets to the toilet, urine drops. That's a symptom that merits him seeing a urologist. So I think he should find his way to the general hospital for proper evaluation.
Okay, so talking about the urologist, you are a urologist. So how does it go? Are there particular days? I know General Hospital works with days, but let's take this call. Hello.
Hello.
Yes. Good morning.
This is Alaji Sheun from Agungi.
Alaji Sheun from Agungi.
Yeah.
Yes. Talk to us.
My grandson is 9 years old.
Okay.
At times he complains that his penis is peperish when he wants to wee.
Okay.
And he will shout. But when he takes his bath, in about 30 or an hour, it goes off. Can this lead to this prostate cancer? Or is there any other disease?
All right. Thank you. The doctor will attend to your question. Thank you. Okay. So, doctor.
So he's talking about his grandson who is 9,
yes,
who screams when he's urinating. But that symptom seems to be relieved when he's having his bath or he has had his bath.
Like 30 minutes after.
So it's commoner for women to have urinary tract infection because of the way the female private area is constructed. But for a man or a male child to have urinary tract infection, it needs to be properly investigated. So I suggest that child be referred to the pediatricians first, and then if the symptoms persist, or if they find something and the child needs a urologist, they will refer the child to a urologist. I think the child should go and see a pediatrician first.
So how does it work with General Hospital Ikorodu? Like I was saying, I know for instance today is a Thursday, if I'm not mistaken. I know you would be attending to some pregnant women, giving them numbers and all of that. Some days is for the gynecologist and all. But for your department, how does it work if a man decides to come down to General Hospital today to see you?
So if he comes into the hospital, if he comes with a referral letter to the urologist directly from some other physician, he'll go and see the nurses on the second floor, and they'll give him an appointment date to see me on Tuesdays. I run clinics on Tuesdays. For the patients who may just walk into the hospital, they will need to go to the GOPD first, and then the GOPD, that's the GOPD. Those are the ground floor. Okay. Those will evaluate them and then refer them to the urology clinic.
So they can just decide to come at any time?
No, that's not what I said. I said if they have a letter.
Yes, for those that have a letter, yes.
They come to the second floor. The nurses will give them a date to see me.
Okay.
For those who don't have a letter,
they
can come to the general practice clinic. Those ones will now refer to the urology clinic.
So let's talk about the fact that sometimes you just have these pains, or sometimes you have issues with urinating, just like we have said, different forms of them, and then maybe after some months and the thing just disappear. Medically, what do you have to say? Maybe it was a miracle or something. What would your advice be to people like that, such men? But let's take another call before you attend to that one. Hello. Yes.
Yeah, in addition to my question, this is Sabeki.
Okay, Sabeki.
Yeah.
Okay.
The doctor said if somebody if you have a letter to see him, so how do we get letter to see her. Maybe we get it from still young or we get it from RKD or somewhere else.
All right. Thank you very much. Thank you.
All right. So because it's a specialty clinic, people cannot just walk in, walk into the hospital and see the urologist. For you to see a urologist, you need something is happening to you that needs my specialist review. So those who may come with a letter, like for example, now I mentioned that child should be sent to the pediatrician. The pediatrician will give that child a letter to see a urologist. Okay. So a letter will be addressed to me stating why they are requesting for a urologist review of the patient. And then if it's that you want to see the urologist and you don't have a letter, you can walk into the general practice clinic from any hospital really.
Okay.
And then you let them know what your problems are and that you feel you want to see a urologist. They will now give you a referral letter to see a urologist.
Thank you very much, Doctor. Now, this will be my last question. Hopefully, if there are no more questions. When a man says that he was having pains and then 3 months later or something, the thing just disappeared. Now, is it normal? Do we have situations where difficulty in urinating will just decide to leave by itself and just say, okay, let me just free this man. I've tortured him enough. Are there cases like that?
Okay, so I want the public to understand something. I mentioned at the outset that we have 2 kidneys that produce urine that enter the bladder.
Yes.
And then when the bladder is full, it sends a message to the brain, go and look for a place to urinate. And then urine is passed from the bladder through the penis into the toilet. So sometimes when you have problems that are evolving, either from infection or from increased prostate size, the way God created us is such that if there's obstruction, the body tries to overcome that obstruction by increasing capacity of the organ in front of where the blockage is. So then the patient now begins to experience, for example, somebody who has prostate enlargement that was stopping him before, and then it begins to experience bladder wall. The bladder begins to work excessively so that the patient can void well. It will compensate until the bladder cannot expand or become thickened again. Okay? And usually by that time, patient may have infection or may have bladder stones or may even have affectation of the kidneys and as have gotten swelled because you have been urinating at a higher pressure that God designed the bladder to urinate. And by the time the patient has manifested complication, things will have become a little bit more damaged than the initial part. So, will I say it's a miracle? Our people like to think like that. But when you have a symptom, just like pain, the way my teachers taught me, pain is a symptom of actual or potential tissue damage. So if your body has given you a sign of something, it behoves on you to do something or to take action, so you can protect your body for it to serve you longer period. So, and it's usually better for things to be discovered early than for them to be discovered late. I know life is a little busy and stressful for everybody, but if your body gives you a sign, I'm having a headache, my waist is paining me, this leg is feeling heavy, there was blood in my urine last month, I need to get it checked out. It's good for us to try and find time and take action, so at least we will know we did due diligence on our part. Prevention,
they say, is better than cure.
Yes.
So let's take WhatsApp messages now. This is coming from Sholaja. I'm sorry, pardon me. This is coming from Sholaja from Igbobo, which, I think the answer is straight to this one. Which is preferable, the natural, herbal way or medications? For I guess the answer is straight, but then maybe you need to answer that.
Like I tell my patients, I don't badmouth what I don't understand. Okay, and many elderly people will tell you that before medications came, herbs is what they were using. All right, so I can only advocate for what I'm sure works and what I know is safe. But you don't expect to come to and see me in my clinic and prescribe herbs for you.
Definitely
I won't be able
not.
to prescribe herbs for you.
Definitely not.
I will listen to you. I will examine you. If I find there's a problem, I will discuss it with you and tell you the options of treatment I can offer you. And then you now have to choose what you want to take, because there's no point me writing a prescription, you leave the consulting room and throw the prescription in the bin. Okay, so me and you have to come to an understanding of what the issues are. We have to be in agreement of what the plan of you getting back your health is going to be, and we take it from there together.
Thank you so very much. This is Prince. This will be the last one from WhatsApp. Prince is asking that okay, I don't think this can happen. I think the best answer to this is Prince is asking for contact, which is not possible. But again, please, doctor, I think you need to tell our listeners out there how to reach out or where to go to again for the benefit of this person sending this WhatsApp message. I am sorry, sir, Mr. Prince. Contacts cannot be shared on radio. Thank you.
Well, I can be found on Tuesdays, General Hospital Korodu, where I run my clinic. But like I said, for you to see me as a urologist, you need to have a referral of some sort. So they can come to General Hospital Korodu.
Thank you so very much. Doctor, before you leave, what would your advice be to every man out there, boy, father, youth, every male out there? Your medical advice as a consultant urologist, General Hospital Ikorodu.
Okay, yes. My advice to all men or all males, regardless of their age group, for the newborns, this is to their mothers, is for them to observe the urinary stream, to be sure that it acts very well. The child doesn't cry when it's urinating, and it's feeding well. For those the teenagers and the young adults, to avoid risky sexual behaviors, and if they have complaints such as painful urination, blood in urine, painful scrotum, testes, they should please seek a urologist for proper treatment and evaluation, because it can come back to bite them down the line, with regard to infertility or even what we call urethral stricture disease. Okay, and then for the elderly men, in addition to knowing how you urinate when you were a younger person before, is also to present early if you notice that, for example, you are urinating too frequently at night, or the urine is not flowing as well as it could. And this is because early detection of difficulty urinating, helps protect the kidneys. That is one of the largest complications that I wish my patients can be protected from. When this difficulty urinating is diagnosed late, usually patients have some degree of kidney problems, which I really wish patients don't have to suffer from. So I think that's my two cents.
But when you say that if not quickly diagnosed and all, have there been cases at all? Sorry to still ask you this one more question. Have there been cases of a male patient, losing his life due to maybe prostate cancer, urinary difficulties, or what sort of issues with difficulty in urination? Okay,
so for the younger age group, okay, I've had patients who fell across a gutter, a manhole, and then the stuff hit their groin, and then they realized there was blood at the tip of their penis. And for those patients, most times you have to divert urine. You put a tube in their belly. You allow that place to heal. Okay, and in about 6 months, you offer them surgery to join the road together back. For those with prostate cancer, or let me talk about the one that is not prostate cancer first. That's BP, which is also quite common. Enlargement of the prostate gland.
Yes.
For those who present early, you usually start them on a combination of lifestyle modification and medication. And they take this up to the time where the medication fails to give them the symptomatic relief that they once enjoyed. Okay? And going forward from that patient will be offered surgical management, which is not part of what we are discussing today. For prostate cancer, it not only blocks the road, they all have other complications. They maybe bleed from it. They have shortage of blood. They have loss of weight. They can't eat well. It can also block the pipes that bring urine from the kidney, making us have to do other things for them. So it's the kidney is where the water comes, the urine comes from. If you have something down the pipe that is blocked, your kidney keep continue producing urine. So if the water must find a way for it to pass.
Definitely,
it
true.
must find a way. So it will give the patient symptoms. Okay, but if you see the wrong person, or if you come to the right person late, things may have become damaged, which is what I really don't like patients to suffer. Because then you now begin to need tubes, you may need dialysis, and sometimes the kidneys are completely gone by the time they get to us. So if you have symptoms, please just find the time, seek appropriate care, see a urologist.
Thank you so very much, Dr. Odutola Oyewo, consultant urologist, General Hospital Ikorodu. Thank you so much for your time, for joining us on the issues today. This is how far we can have it on the issues. But then next week, Thursday, will be another good time with General Hospital to talk about healthy conversations. My name remains the same, Okpayemi Adibambo, urging you to stay safe and live a healthy life. God bless you.